Dr. John Paul James, a biomedical neuroscientist, and welcome to the Holistic Health Coach Corner. We've heard reports from the White House and Dr. Fauci as it relates to the coronavirus and COVID-19 hitting the African American community more than any other race in the world. We've heard reports of health disparities within our community, like diabetes and hypertension and all those other kinds of diseases that are in our community, and how the virus is connecting to those diseases. Now, a lot of people may have something and not even know that they do. You can also have an immune deficiency and not know that you do. What we found out is that there are things that we can do. We've got studies from the World Health Organization, also Stanford Medicine from Harvard. We've got all these kinds of reports, and we've compiled data and understanding about what we need to do as a community. You understand that we are certified in the area of exercise therapy, and we're able to help you. Now, we have an online platform that is able to get you through what you need to do. Now, I'm talking about before you're infected, and I'm talking about when you're coming out. You can also be able to get help online. Call my office at 240-383-4800. Now, listen to this report from CNN. We were listening to a report, a CNN report with Chris Cuomo, and who has been infected with the coronavirus or with COVID-19. And he's giving his story about what he needed to do to survive having the virus. Now, Chris reports that he spoke with a pulmonary specialist and he gave him instructions about what to do. Now, here's what Chris says. Chris says that the virus wants us to lay down. You need to get your rest, but you can't stay in a rested state, that you have to get up and move. He further says that the fever that you get softens you up, making your body hurt, so you don't want to move your body, because it wants, or the virus itself wants to do, is to get into your lungs, and you will feel it constricting your chest as well. Now, we also found out about the virus, and that is that it connects primarily with people with underlying illnesses. So Chris says that he had to admit something. He has something called a low IgM levels, which is the primary immune response antibody. Now, it could be genetic, or it could be cultural for him, and it makes him susceptible to things like bronchitis or other infectious diseases. Now, here is something else. You cannot sit in the pool of sweat and not move. You've got to get up and you've got to start moving and not just sleeping in it. The pulmonary expert says to get up, and told Chris that you have to get up and you need to stretch your torso. Now, regardless of the pain. So he asked Chris, did the stretching, or does his chest hurt? And if he tried to stretch, would it hurt? Chris reported yes. But the pulmonary specialist said, even though it hurts, you got to stretch your torso. So even with pain, Chris stretched his torso. Then the pulmonary specialist asked him to hold his breath for 10 seconds and asked him, could he do it? Chris says no, but then the doctor tells him to do it anyway. You want to keep your virus out of your lungs, and you have to do it. And understand this, you may have fear, but you got to have the right approach. You have to start breathing deep. You have to use deep breathing exercises, because you don't want it to sit in your lungs. And so here's what we've come up with. We did studies, or looked up studies from Stanford Medicine, and we understand in order to deal with this, you've got to become physically active. You have got to exercise. You cannot just sit down. You have got to exercise. Now, what we're saying to everybody now is this. Before you even become infected with the disease, before you get coronavirus, what you need to do to combat it, one, is to practice deep breathing exercises. The other thing you've got to do is you've got to exercise along with all the vitamin uptakes in terms of upbeating your immune system, but you also have got to exercise. That is going to be key for you. You've got to exercise. Now, we have an online platform for all of this. For the lung exercises that's needed, we also have an online platform for physical exercise that you're going to need to combat COVID-19. What I'd like for you to do is to call my office at 240-383-4800. 4800. Again, call my office at 240-383-4800 and let us help you as you're dealing with this. Now, our coaches are standing by and they want to be able to help you. Now, we want to be able to help you through the process. This is prior to being infected, and this is when a person has been infected and coming out of the coronavirus scenario. You're going to have to practice what we call deep breathing exercises. You're going to get some physical exercises coming in, and you're going to have to understand how to stretch. And what we are is specialists in exercise therapy, and we're able to give you the help that you need. So what I want you to do is to call my office again at 240-383-4800. We have an online platform. You don't have to come in, but we certainly are able to help you. I'm Dr. James.